Rheumatology. I'll start with Still's disease. Now, this is a febrile syndrome in young adults of 16 to 35 years, and there are multiple organs which will be affected in this. Diagnosis of exclusion: there will be high grade fever, arthralgia, there will be sore throat, rash, lymphadenopathy, hepatosplenomegaly, pleuritis, pericarditis. There will be increase in the ferritin. Rarely there will be due to septic meningitis, cranial nerve palsy, iritis, peripheral neuropathy. Now, rheumatology में anti U1RNP is due to the mixed connective tissue disease or Sharp syndrome, and CREST is for centromere, anti-centromere. Rheumatoid arthritis, poor prognosis factor are RF positive anti-CCP antibodies. If there is X-ray shows early erosions less than 2 years old, extra articular features are there, HLA-BR4. There is insidious onset of rheumatoid arthritis. Anti-Jo1 is for polymyositis, drug-induced lupus. There will be arthralgia, myalgia, malar rash, and pulmonary involvement will be there. Most common causes procainamide and hydralazine. ANA पॉजिटिव रहता है, एंटी DSDNA नेगेटिव, एंटी हिस्टोन एंटीबॉडी in 80 to 90% and anti-Ro and anti-Smith in 5%. So you have to look for this anti-histone antibody in drug-induced lupus. Anti-synthetase syndrome, mechanical hands proximal myopathy is there. Anti-histone antibody 80 to 90%, anti-Ro, anti-Smith 5%. Then anti-synthetase syndrome, mechanical hands, proximal myopathy. Greater trochanter pain syndrome, there's fibroelastic iliotibial band, most common 50 to 70 years में. Clinical feature pain over the lateral side of the hip and thigh, and tenderness on palpation of greater trochanter. HCQ monitor visual acuity, not ECG. ठीक है. Then DIP में distal interphalangeal joint. अगर इसमें आपको बोगी swelling दिख रही है and the pain is worse in the morning and it is improved with activity, then it is due to psoriatic arthritis. If in the DIP joints there is bony swelling, Heberden's nodules, pain is worse with activity, then it is due to osteoarthritis. ठीक है. Now rheumatoid arthritis treatment at least 2. Sulfasalazine or methotrexate, HCQ, and leflunomide. So this shim is used. Out of this only 2 you can use. Then DAS 28 CRP and DAS 28 ESR more than 5.1. अगर ये increase होता है, this is how you will assess whether the treatment is good or not. Then in that case you can use anti-TNF biological medication. In this you can use etanercept, adalimumab, certolizumab, golimumab, and infliximab. So ECG, AECGI.